My name is Teresa, and I am one of the physical therapists from Boston University. Happy to be with you today. Today we'll talk about exercise intensity, particularly how hard to work and why it matters. And again, I'm one of the physical therapists in part of the team from Boston University. We're at the Center for Neurorehabilitation, right at the Boston University campus. This is our contact information on social media. We'd love to hear from anyone at any time. So to get started today, we talk briefly about what is going on in the body during aerobic exercise. Typically, someone is moving the large muscles in arms and legs, and the body responds by breathing faster and more deeply. That maximizes the amount of oxygen in the blood, and the heart also starts to beat faster, which increases blood flow to the muscles and back to the heart and the lungs. It also increases blood flow to the brain. And in the brain, with exercise, we get a lot of information from animal models, but we can see an increase in these neurotrophic factors, which are chemicals that we think can actually structurally help the brain and the nerves connect better and maybe communicate better. When we're trying to study what's going on in the brain, one of the best ways we can get an idea is from behavior. So in humans, we study their movement, their thinking, their mood, and that sometimes gives us an idea of what is going on or what is changing in the brain, especially related to exercise. And this will come up as we talk through some of the research studies. Well, what is exercise intensity? It can be measured or explained as the amount of energy expended during an activity. But in more practical terms, we would feel this as how hard someone is working during exercise. And what is the evidence for exercise intensity in people with Parkinson's disease? And I'd like to share with you information from two recent studies. The first one was commonly called the Parkin-Shape study, and this was done in the Netherlands. This was a study of 130 people between the ages of 30 and 75 who were in the more mild stages of Parkinson's and who were not exercising regularly. This was a study actually done in people's homes. And what the researchers did was divide the group randomly into two groups, two categories. The first group was the stationary cycling group, and the second group was the stretching and relaxation group. Both groups worked on their activity 3 times a week for about 30 minutes. The stationary cycling group had a goal to work of a certain percentage of their heart rate. And they started off in maybe a lower percentage, about 50%, and they worked their way up to 70% or even a little bit higher. The stretching and the relaxation group also worked for 3 times a week, around 30 minutes. Both groups had a coach to help them, and they used a motivational app to try to stay with the exercise program. At the end of 6 months, the researchers took a look at a measure we commonly use called the Unified Parkinson Disease Rating Scale, which has a movement section that you might be familiar with. In your neurologist's office, you might have gone through a series of movements where you're trying to move as quickly and as big and as fast as you can, moving in your arms and your legs. Well, that movement section of the test is what the researchers looked at the end of this 6-month study. And what they found was the group that did the stationary cycling had less progression in this UPDRS assessment compared to the stretching group. In another separate exercise study, again looking at the evidence related to exercise intensity, this study was called the SPARKS trial, and that's the short acronym for the Study in Parkinson's Disease of Exercise. This study looked at people who had recently been diagnosed with Parkinson's disease. They looked at 128 people, again, who are newly diagnosed. So that's this term de novo that we'd use here. They were not on any dopamine replacement medication. And the groups in this study, 128 people in the early stages of the disease, as we mentioned. And the groups in this study were comparing usual care, just typical activities, to two walking-based groups. This is walking on the treadmill. One group walked at a moderate intensity, and that was measured by a percentage of heart rate. This group was monitored to stay at between 60 and 65% of their maximum heart rate. And the higher intensity group, which were monitored to maintain between 80 and 85% of their maximum heart rate. At the end of that study, again, the researchers, so these people were exercising, the recommendation was 4 times a week on the treadmill. In reality, it turned out to be more like 3 times a week, and that's what the results are based on. But they did that for 6 months, and at the end of 6 months, the researchers again looked at that UPDRS movement assessment, and they found that the slowest progression in the group that was exercising at the highest intensity compared to the usual care group. And so in a very general sense, what we can learn from these two studies is that for the people in these two studies, the ones that exercised at the highest intensity had the greatest benefit. And we can see here that it seems that the level of intensity was more of the key ingredient, perhaps rather than the style of activity that they were doing. So bearing this in mind, how could we put this in practical terms? And one way to do that is to consider how could we measure exercise intensity. And there's really 2 most basic ways to measure. One is to use heart rate as a measure. But we do want to bear in mind that sometimes based on people's medication or sometimes just the nature of their Parkinson's disease, their heart rate response might be blunted. So this heart rate as a measure of intensity may not be the best measure for everyone. Another way to measure exercise intensity is how you feel. And we'll kind of go into these 2 separate categories. Using the measure of exercise intensity via heart rate, we get information from the American College of Sports Medicine that a moderate intensity heart rate would be considered 65 to 75% of maximum heart rate. And some ideas of what moderate intensity exercise means: riding a bike, doing yard work around the house, walking at a brisk pace, and generally an idea of around 2.5 miles per hour on a treadmill, or that averages to about a 24-minute mile, also commonly considered about 100 steps a minute. Another category of intensity based on heart rate is this idea of high intensity. And again, through the American College of Sports Medicine, we consider high intensity greater than 75% of maximum heart rate. And those style activities would be an even faster walk, maybe some sport-related activities, just to get an idea of what we could consider high intensity. When it comes to measuring heart rate, there are a number of formulas that help give us an estimation. The simplest one involves taking the number 220 and subtracting your age to get the maximum heart rate. For example, if you're 70 years old, 220 minus your age would give you a maximum heart rate of 150 beats a minute. And then we would take a percentage of that maximum heart rate to get an idea of what a target heart rate would be in, say, the moderate category or the maximum, the high intensity. So for example, if your target was to work at a moderate intensity, and we considered that 65% of a maximum heart rate, in this example, 65% of 150 would be 98 beats a minute. And again, that's a general idea, but it gives you some measure, something you can count and maybe get an idea if the level you're working at would be considered in that moderate intensity range. Another way to measure the exercise intensity is this idea of how you feel. So how you feel in general as you're moving or exercising. For a moderate intensity exercise, you want to be breathing harder, probably feel like you're sweating, getting that idea that you're working somewhat hard. The talk test is another way of measuring we're getting a sense of how you feel in terms of intensity. In a moderate intensity activity, you should still be able to talk, carry on a conversation, but you shouldn't be able to sing. If you could sing the happy birthday song all the way through without changing your breath, you're not working hard enough to be in the moderate category. In the high intensity category, you really wouldn't be able to get out more than just a few words if you were breathing at that level. Another way of measuring how you feel is this idea of perceived exertion. Generally, we're talking about a scale, usually a number scale, that gives us a framework of what's the light end and what's the higher end. And based on that, we want to judge ourselves as to where we are on the scale. One idea is, or this is a very commonly used scale, it goes from 6 at the light end of exertion to 20 at the hard end. The idea for moderate intensity is to try to work somewhere in the middle, this idea of, so we'll say 13, 14 on that scale, keeping in mind the same idea of working somewhat hard. Another scale, similar idea, but it's just broken down into a scale of 1 to 10. Sometimes that's a little easier to frame in our minds. So if that's the scale, we want to be working at approximately a 5 or a 6 on that scale. That's somewhat hard, challenging. What is recommended for all of us? And this is based on the guidelines for physical activity for all Americans. It came out an updated version in 2018. What's recommended for all of us is 150 minutes per week of moderate intensity exercise. And what I think we might be able to gauge as a take-home message for people with Parkinson's disease is how hard to work, based on the evidence, would say at least moderate intensity. What to do? Any aerobic exercise that you enjoy for 115 minutes of the week. How to do that? Break it down. Start where you are at present and maybe create some small goals to get you to where you want to be. So 150 minutes per week could look like 30 minutes a day for 5 days. That 30 minutes by itself could be broken down into 10-minute intervals 3 times throughout the day. And why does this matter? The evidence we have suggests that a higher intensity exercise may have more benefit for people with Parkinson's disease, especially those who are in the early stages. So as always, we are here to help. We are a team of physical therapists at Boston University, but through the support of the APDA, we are here for everyone across the country. We have a phone number that it's easy to reach us. We'd love to have an email, any contact that we could help you with in terms of maybe an individual question for exercise. We would love to be involved. So please feel free to reach out and contact us at any point. I think what we'd like to do is take your questions now. And I think we'll bring on another of our physical therapists, Tim Nordahl, to help kind of facilitate the questions. So anything you want to talk about or ask, maybe you could ask us in the chat and we could keep talking about this topic.
Hey, hello everyone. So Teresa, we had a few questions that came in by email. So I think maybe we can start off with those. And then while Teresa and I are talking about that, if you have any other questions, feel free to add them to the chat and we'll try to get to as many of those as we can. So Teresa, a lot of good questions here. I guess I'll just start with this one. So I've read about interval training. Should I be doing intervals to help get more intensity in my exercise program?
Tim, that's a great question. And that is a technique I might just explain for a moment that involves a short duration of a more higher intensity exercise. So perhaps maybe an exercise where you're going very quickly in what you're doing for a short period of time. You often find your heart rate rising, you find yourself breathing, and then it's followed by a period of time where you're not working as intensely. And there's a lot of different ideas about what to do, but generally a short period of higher intensity exercise. And sometimes that is a great way to add more overall intensity to your workout. There's also been some evidence that working in these shorter bouts of higher intensity exercise can give people a similar benefit over compared to working out for a longer period of time. So it's interesting. It's something that if it's safe for you to try, you might want to consider. A short burst, say if you're on a walk and you're trying to keep up a brisk pace, say from here to the end of the street or to the next tree, you try to walk quickly as you can, assuming that's safe for you. And maybe you alternate that as you're going through your walk. So it's an interesting strategy. Sometimes it feels kind of fun, and you're definitely going to feel like you're getting more intensity in your workout.
Right, right. Yeah, I can think of, like, I've had a lot of patients ask me this over the past few months, especially it seems to be getting more and more popular. And I think it's, the thing is, like, we know that the two studies that you pointed out really were looking at more of like a steady state exercise. So we have the best evidence for that, but the interval might be a nice way of getting started with it or working a little bit of variety. And so I definitely love that somebody asked us about that.
Yeah.
Now, the next question I see is, I went to boxing class before the shutdown. So is that a moderate intensity exercise? How do we classify boxing?
That is a great question, because that is so popular. And within each boxing class, generally speaking, there's a certain amount of time for warm-up. There might be a certain amount of time for stretching. So those type of activities, very relevant and important, but probably not getting the heart rate up to the level that we consider the moderate intensity. Usually during boxing classes, there's certainly a good amount of time of quick drills or actual movements in the class that does get the heart rate up there. So it's interesting to think about, within, say, a 60-minute boxing class, how much of the time is someone working hard enough to get their heart rate up there? Maybe it's 30 minutes, maybe it's 20 minutes. So it is good to keep track of the amount of time within a class like that that would be considered moderate. I would say generally boxing classes have a great variety of activities that they get to. Probably only a certain percentage of the time it would be in that moderate intensity.
Yeah, yeah. Now, how about this one? I'm walking 3 times a week. What can I do to get more intensity?
Understand. First of all, that's a great question that someone's able to get out 3 times a week. That's wonderful. To increase intensity, one first idea is to try to go faster. And that may or may not be safe for everyone, but that's one idea. Say you have a route that you tend to take in the neighborhood and you have a ballpark that it generally takes you, say, 25 minutes. Could you make a goal for yourself to finish that same route in, say, 22 minutes? Those are just some general ideas, but going faster is the first idea. Sometimes people have a choice of using elevation, either where they're walking or if they're using a treadmill. That also creates a greater intensity. And again, that has to be safe for everyone and not something that triggers a discomfort or anything like that. The interval idea we previously mentioned is a good one, where for short bursts of time going faster sometimes feels more manageable in an outside walk.
Mm-hmm. Now, this one, I hear this all the time. So should I buy a bike or a treadmill to help with my exercise program?
I know what you mean. I have heard that question before too. And I think the answer is it depends on the person. I don't want to indicate that someone needs to buy equipment in order to have a complete exercise program. So I hope I don't give that impression. I think it very much depends on what you enjoy. For example, and also we're talking about purchases that, that could be quite a bit of money too. So that it's not something we want to say is necessary. But just for example, a treadmill provides some excellent benefit for walking in the sense that it by itself provides a pace and a speed that is set. And so people may find themselves starting off walking in general with a brisk pace that they can keep up, but over time find that gets slower and slower. On a treadmill, the treadmill doesn't stop based on the pace you set it. So we will find a way to keep up with that treadmill. So it works very well as a cue to keep up the same level of speed. We can also practice our walking pattern. So it gives us a lot of advantages in terms of other walking goals. However, if someone finds themselves freezing or perhaps is not comfortable on a treadmill, a bike can give just as much intensity. In a bike, of course, you are the one that keeps up the pace, but you have advantages of setting different resistances on the bike. So I would say each one has certain advantages. Neither one is necessary. And the biggest question is what would be most enjoyable to the person.
Yeah, that's what I always say is like the best thing to buy is the thing that you're really going to keep using.
Yeah.
So like picking something that really works for you and that will motivate you over time. I guess a couple other questions came in, and I'm thinking since we're already talking about the bike a little bit, I should probably read you this one. Somebody wrote into the Q&A, can you say anything about the recommended 80 RPMs for cycling? RPM meaning revolutions per minute, which is a way to measure the speed of how fast you're pedaling.
Absolutely. And we know we have some research studies that were done a while ago related to quick movement on the bicycle. And in some cases, the movement was faster than what the person would normally do. And in some research studies, that speed was almost, I don't want to say exactly forced upon them, but they had to keep up with the person who was on a bike where they were kind of yoked to each other. And some interesting results were found that way. So in terms of guidelines for the revolutions per minute, as you're mentioning, the questioner is mentioning, an idea might be on the bike, if this is your preferred mode, could you kind of investigate what is typical for you under your regular workout that you're doing? Based on that, how do you feel using some of these perceived exertion scales? Does it feel like you're working somewhat hard? If not, could you use the RPMs that usually we see on a display on the bicycle? Could you use that as a way of setting a goal for yourself? So say, for example, you're at 70 RPMs and you can do it. It just feels like maybe you're not working that hard. What if you did try 80 and that was something you felt was a challenge? You could feel your breathing change. I think using the RPMs is a great way to set a goal. And 80 for some people might be quite a challenge. For others, maybe not so. So I think in general, using that method to set a goal might be kind of the best advice.
Now, how about this? So as you get in better shape, will we get to where we cannot achieve 80%? I think referring to the 80% of the maximal heart rate.
It's certainly possible. And again, I very much want to keep in mind that not everyone has, some people have a more blunted response to heart rate. So as we do get, say, in better shape or perhaps more efficient with how our bodies use oxygen, it may be harder and harder to achieve these higher intensity goals. So in that case, what I might suggest is, first of all, continuing with what you enjoy as sort of the most important thing. You might consider increasing the duration of what you're doing, assuming that that's safe. So say, for example, you're someone that does a walk in the neighborhood, as that example, for 20 minutes. Well, what if you tried one for 30 minutes? How could you keep that level of intensity if you were doing this for a longer period of time? I think that's maybe one idea to keep level of intensity as kind of a goal we're working towards.
Yeah, and I'll talk to patients too, like especially if they're not exercising regularly when they first start seeing me. Sometimes they'll see it's pretty easy to get up to that 80% of their maximal heart rate. But then just like you're saying, sort of like as the body gets in better shape, you don't respond as strongly to the same, the same run you used to do. So for a little while, you have to make it a little bit more intense, but hopefully, a lot of that levels off and you can find a consistent routine that's manageable after a few weeks. So now someone wrote into the chat, I'm doing fine, getting the recommended moderate exercise. But every time I try to increase it to the higher intensity, my pain level increases or I get injured. Any suggestions?
Okay, yes, that's an extremely important question, and also excellent work at getting that moderate level of exercise already. I mean, that's wonderful. But understand that when we're recommending trying to get to higher intensities, we do want to be very careful that it's not provoking pain or that no one is getting injured. So I guess I'm curious a little bit about what style exercise that the person is doing. And then with the increase in intensity, I wonder if even body mechanics are changing, or there's something we really want to watch over in terms of form. I think I would be curious if another style exercise, something different that perhaps they're not already doing, might be a way to keep pushing the exercise intensity. As you were saying, Tim, once we get used to a certain style exercise, we get more conditioned with it. When we change to something else, we're starting at something that's new and we're not as familiar with, and it might be easier to get that higher level of intensity. So if walking is something someone's already doing, perhaps maybe they have access to a bike. I would also want to indicate that certain strength style exercises have quite an aerobic component to them. So some people are doing exercises for strength in their house, and you find yourself getting quite out of breath as you're doing that. That might be a way to increase exercise intensity in a way that someone could perhaps take a break and sit if that would help their pain. I think maybe this idea of trying a different style exercise might work.
Yeah. And I think it's great, because another question I saw in the chat was, so I'm kind of glad we're on this topic, was, would walking up and down a staircase qualify as aerobic exercise for PD?
I would definitely say, depending on how your response is to the stairs, walking up and down the stairs is quite aerobic. There's one research study, this is not related to people who have Parkinson's disease, but they used walking up and down the stairs in these very small amounts, about a minute of walking up and down stairs, as a way of, they called it almost like an exercise snack. So a very small amount of exercise throughout the day, but it was driving up the heart rate and exercise. So stair climbing can be quite aerobic.
And then another person wrote in that they found it really great to use a phone app to record their power walk time, their rate, the route, the amount of calories they burned. So I think that was just another comment that came up in the chat, is if you're trying to track how you're doing with intensity, sometimes these new apps that are coming out can really help with that quite a bit.
I'm just going to say that can be quite motivating too, because you can really see the changes that you're making.
Yeah. I think that was about all that we had for questions here.
Okay, I do just want to mention, we are doing another webinar series, or another webinar session next Wednesday. And this one, we'd like to have all the physical therapists who've been speaking throughout the last several weeks as part of a panel. And we'd love to talk about exercise and physical activity in the new normal, especially as things are starting to open up, but perhaps are not back to the way they used to. What are some strategies for how all of us can exercise in this new normal? And so ahead of that talk next week, if anyone has specific questions, we would love to know, even if you had a chance to write them out ahead of time. We'll be able to take questions during our talk as well. But if we have them ahead of time, we can even try to get to them in more detail. And so what I'd like to do is refer everyone to our email address at Boston University. That's rehab@bu.edu. This is for all the physical therapists in the Center for Neuro Rehab at Boston University. And we will be coming to you as a panel for the discussion next Wednesday. I really want to thank everyone for their kind attention today. Sessions always seem to go by so quickly. We appreciate everyone's time, and we will see you again next Wednesday with our panel discussion. Thank you so much.